Your liver can be more than 75% damaged, and you may feel almost nothing. No sharp pain, no obvious warning, just a quiet, slow deterioration happening inside you right now while you go about your day. That is not a scare tactic. That is how liver disease actually works. It is one of the most silent killers in medicine, and it is becoming more common, not less. The problem is that most people are waiting for a dramatic symptom. They are waiting to feel sick. But the liver does not work that way. By the time the obvious signs appear, the jaundice, the swollen abdomen, the damage is often severe. So today, we are talking about the warning signals that come earlier, the ones your body is already sending, the ones most people dismiss, explain away, or never connect to their liver at all. There are 7 of them, and at least one may already apply to you. Here is what most people get wrong about the liver. They think of it as a detox organ, something that filters out alcohol and toxins. And yes, it does that. But the liver is also your primary metabolic organ. It regulates your blood sugar. It produces the proteins that keep your blood clotting properly. It processes your hormones. It manufactures bile for digestion. It stores and releases energy. When the liver starts to fail, even slowly, even partially, none of those systems work the way they should. And the symptoms that result often do not look like liver disease. They look like fatigue, skin problems, digestive trouble, brain fog, things we explain away as stress or aging or a bad few weeks. That gap between what is actually happening and what we think is happening is where the danger lives. By the end of this, you will understand what each of these signs means and why the liver specifically produces them. You will know which combinations of symptoms are more alarming, what to ask your doctor, and what simple blood tests can give you a clearer picture within days. Let us start with the one almost everyone ignores. The first sign is persistent fatigue that does not improve with rest. Not ordinary tiredness. Not the fatigue that goes away after a good night of sleep. This is a deeper, heavier exhaustion, a fatigue that is still there in the morning, that makes basic tasks feel disproportionately hard, that does not improve no matter how much you rest. When the liver is under stress, it struggles to convert stored glycogen into usable glucose efficiently. Your cells begin to run low on energy. Simultaneously, the liver produces less of the proteins and enzymes your body needs to function at a normal metabolic rate. The result is a fatigue that is cellular, not psychological. It is not burnout. It is your body running on a compromised engine. Fatigue has many causes. We are not saying fatigue alone means liver failure, but persistent, unexplained fatigue, especially when paired with any of the signs I am about to describe, warrants a proper liver panel from your doctor. The second sign is itching skin with no rash. This one is frequently misdiagnosed. Patients go to dermatologists. They are given creams. The creams do not work. Here is why. When the liver is not processing bile properly, bile salts begin to accumulate in the bloodstream. They deposit under the skin, and bile salts are intensely irritating to nerve endings. The result is pruritus, itching, often on the palms of the hands, the soles of the feet, or widespread across the body. There is no rash, no visible inflammation, just an itch that will not stop. If you have persistent skin itching with no obvious dermatological cause and no relief from antihistamines, that is a signal worth investigating from a liver standpoint. This is one of the more specific signs on this list. The third sign involves changes in urine and stool color. Most people do not pay attention to this. They should. Dark, amber-colored urine, the kind that looks like strong tea or cola, can indicate that bilirubin, a waste product the liver is supposed to process, is spilling into the urine instead. This happens when the liver can no longer filter it properly. On the other side of that equation, pale, clay-colored, or grayish stools. Under normal conditions, bile gives stool its characteristic brown color. When bile flow is obstructed or impaired, as it can be in liver and gallbladder disease, stool loses that pigmentation. Together, dark urine and pale stool is a pairing that clinicians take seriously. Either one alone could mean other things. Together, they form a pattern that points toward a biliary or hepatic problem. Do not dismiss this. If you notice this combination lasting more than a few days, seek evaluation promptly. The fourth sign is swelling in the abdomen, ankles, or legs. The liver produces albumin, the primary protein that maintains fluid balance in your bloodstream. When albumin production drops, fluid leaks out of blood vessels and pools in surrounding tissue. In the abdomen, this is called ascites. You may notice a growing bloated belly that does not go away, that feels heavy, or that shifts when you change position. In the legs and ankles, it presents as pitting edema. Press your finger into the skin and the indentation stays. Now, swelling has many causes, but unexplained abdominal swelling, particularly alongside a history of heavy alcohol use, metabolic syndrome, or known liver stress, should always prompt a liver evaluation. This is one of the later stage signs. If this is already present, medical evaluation is not optional. It is urgent. The fifth sign is bruising and bleeding more easily than before. The liver produces most of your clotting factors, the proteins that allow blood to stop flowing when you are cut or injured. As liver function declines, clotting factor production drops. You may start noticing bruises appearing from minor contact you would not have thought twice about before. Small cuts that take longer to stop bleeding. Gums that bleed when you brush your teeth, even gently. This is not a blood disorder in the traditional sense. The blood itself is not the primary problem. The liver is failing to supply the proteins that blood needs to behave properly. Easy bruising combined with fatigue and any of the other signs on this list is a combination that deserves serious attention. The sixth sign is one of the most misunderstood: cognitive changes, including brain fog, confusion, and unexplained mood shifts. A compromised liver cannot adequately filter ammonia, a byproduct of protein metabolism, from the blood. When ammonia accumulates, it crosses the blood-brain barrier and affects neurological function. Clinically, this is called hepatic encephalopathy, and it exists on a spectrum. At its mildest, it presents as difficulty concentrating, memory lapses, a subtle feeling of mental slowness, or unexplained mood changes, irritability, anxiety, personality shifts that seem to come from nowhere. People are often told they are depressed or stressed. Sometimes they are. But in the context of liver compromise, those brain changes can have a direct metabolic cause. At its more severe end, hepatic encephalopathy can cause confusion, disorientation, and in extreme cases, loss of consciousness. If you are experiencing unexplained cognitive decline, particularly alongside fatigue, swelling, or the other signs mentioned here, liver function is something your physician should evaluate. The seventh sign is yellowing of the skin or eyes. Jaundice is the sign most people associate with liver disease, and it belongs on this list. But it is here last intentionally, because by the time jaundice appears, the liver is already significantly impaired. Jaundice occurs when bilirubin builds up in the bloodstream faster than the liver can process and excrete it. It deposits in tissues, turning the skin and the whites of the eyes a yellow color. You may notice it first in the eyes, particularly in natural light. Sometimes the skin has a more subtle yellowish tinge that is easier to miss indoors. Jaundice is never normal. It always warrants same-week medical evaluation at minimum. In some contexts, particularly sudden onset jaundice, it warrants immediate care. Now let us put this in the broader picture, because the urgency here is real. Non-alcoholic fatty liver disease, now increasingly called metabolic-associated fatty liver disease, has become one of the most prevalent chronic liver conditions. And research suggests a significant proportion of adults may have some degree of it without knowing. It is strongly linked to insulin resistance, excess body weight, and metabolic syndrome, all of which are rising in prevalence. The insidious part is that fatty liver can progress from mild accumulation to inflammation to fibrosis to cirrhosis. Each stage a deepening of damage without producing clear symptoms until late in the process. Alcohol-related liver disease follows the same pattern of quiet escalation. And it is not only lifestyle factors. Certain medications, viral hepatitis, autoimmune conditions, and genetic disorders can all drive damage without obvious symptoms in the early stages. The liver compensates remarkably well, and that very resilience is part of what makes the disease so dangerous to miss. So what do you actually do with this information? First, if you recognize 2 or more of these signs in yourself, particularly fatigue, itching, urine or stool changes, or any swelling, schedule a visit with your physician and specifically request a liver panel. A comprehensive metabolic panel with liver function tests measures ALT, AST, bilirubin, albumin, and other key markers. They are not perfect, but they give a meaningful window into liver health. Second, if you carry known risk factors, a history of heavy alcohol use, obesity, type 2 diabetes, metabolic syndrome, or long-term use of medications that stress the liver, do not wait for symptoms. Ask for liver function testing at your next physical, even if you feel fine. Third, on the lifestyle side, reducing alcohol intake, reducing processed sugar and refined carbohydrates, maintaining a healthy weight, and getting consistent physical activity are the interventions with the strongest evidence for supporting liver health and slowing or reversing early-stage fatty liver disease. Regular black coffee, in moderate amounts, has a reasonably consistent body of research suggesting it may be protective for the liver, and be cautious with supplements. Many herbal preparations and high-dose vitamins are processed by the liver and can cause harm in excess. If you take supplements regularly, discuss them with your physician. If any signs are severe or sudden, significant abdominal swelling, jaundice, confusion, or blood in vomit or stool, do not wait for a scheduled appointment. Seek care promptly. One final note of context. Every sign on this list has multiple potential causes. Fatigue is not automatically liver disease, Brain fog is not automatically liver disease. The purpose of this is not self-diagnosis, it is pattern recognition. One unexplained symptom may be unrelated to anything serious. 3 or 4 of these signs together, particularly alongside known risk factors, forms a pattern that deserves professional evaluation. Your doctor needs your full history, a physical examination, and lab work to give you an accurate picture. This is the prompt to have that conversation, not a substitute for it. The liver is one of the most resilient organs in the human body. It can regenerate. It can recover. If the damage is caught early enough and the underlying cause is addressed, that resilience is actually part of the problem. Because the liver compensates so well for so long, the window between something is wrong and this has become serious can be years. Years during which the right information, the right test, and the right conversation with your doctor could have changed everything. You now have the 7 signs. You understand what they mean and why they happen. You know what to ask, what to test, and what to change. The next step is yours. Do not wait for a sign so obvious you cannot ignore it. The signs are already there, if you know how to read them. Take care of your liver. It is quietly taking care of everything else.